Hi everyone, it's Dr. Dinesh, your Pharmac faculty for DAMS FMGE. So in this, you can see we are taking the class at Calicut, and today I'm going to tell you the tips and tricks how to remember pharmacology. I have seen most of the students, they feel, difficulty in this subject. But I'm telling you, this is very scoring subject and very tricky subject. If you apply these tips and tricks, you can definitely get the very good marks in pharmacology. So first, I would say कि whenever you start the pharmacology, the sequence is very important. The first, we should focus on the class. Means, what is the class of the drug? Or simply you can say the classification. Second, there will be focus on the mechanism of action. Third, there will be focus on the usage. Fourth, there will be focus on the side effect. So we have basically these four things only. In every drug you will see first class, then mechanism, then usage, and then side effect. And then when you know all this information, you need to correlate it with the clinical subjects. That is called as integration. So let me give you one example. If we say, sir, we cannot remember the class, it is very difficult. It is not difficult. You have to basically either remember some prefix or some suffix. No need to remember the complete drug. Like if I say remember the ACE enzyme inhibitor. So see, all ACE inhibitors are like captopril, lisinopril, fosinopril. They are ending with the pril. All beta blockers are ending with the lol. All alpha blockers are ending with the osin. All ARBs are ending with the sartan. All macrolides are ending with the thromycin. So you remember at least the group. You remember the group, you remember the class, then focus on the mechanism, how they are acting. And then you can see this. This is one of the classification for anti-epileptic drug. So try to first revise the classification. In the classification, I would say like sodium channel blockers. So you can see in sodium channel blockers, these are the drugs. You please focus on this. So the student will be able to know. So you can see this is LOCPL. So you can easily remember Lokpal because we have a bill, Lokpal bill. And who bring the Lokpal bill? Topi wale Baba, Anna Hazare. So Anna Hazare bring the Lokpal bill. So Lokpal by Topi. So you can simply remember this is a sodium channel blocker. So out of the anti-epileptic drugs, these are sodium channel blockers. We have some calcium channel blockers. So first remember the classification. Second thing, after classification, then you see we have made, sir, what are the important focus? See, one drug, what are the important thing? So valproate. So we have made a mnemonic. In valproate, the common side effects are vomiting, alopecia, liver toxicity, pancreatitis, PCOS, rash, obesity, ammonia, tremors, enzyme inhibition. So by this type of small mnemonics, you can make it easy. What are the common side effects? It will be on your tips. After that, you need to focus what are the common uses. So use side effects based on the mechanism. And then in the end of every chapter, make a table like this. Like we have mentioned the seizures type and we have mentioned the first line drug. Because in exam, they ask you either direct question from the DOC or they give you the case and then they will ask you the first line or drug of choice. So by these tables, you can make your own as well. In our workbook, we have simplified everything for the students. This workbook is best for FMG exam. So in the end, always in your table or in your notes, you have to make a table like this. So this will help you to revise. And obviously the last but not least, MCQs revision. So revise the MCQs, see how they are asking the MCQs, how they are framing the MCQs. That will help you in better retention. So that's all. And my only advice for pharmacology, revise. You will get the best result because this subject is very scoring subject. Mostly say this is very difficult. I would say it is most scoring. If difficult, then it is definitely, it improve the score. So we need to revise it and it will help you in your exam. Thank you.